Okay, good morning, good afternoon, good evening po sa lahat. Saan mo pong panig kayo naroon? Welcome to our 228th episode of the Health Updates webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community. And for all those who have just discovered us for today and joining us for the very first time, welcome at sana po marami po kayong matutunan sa ating topic for today. Not so much getting the attention po, no? But I think there are those who have nagpakonsulta na po and may have been diagnosed with this condition. I'm talking about endometriosis, which is a chronic, often debilitating gynecological condition profoundly impacting the lives of numerous individuals. So it presents spectrum of symptoms po, no? So pag-aralan po natin siya ngayong linggong po ito. So in this week's episode, we'll be discussing complex mechanisms underpinning endometriosis, such as yung ectopic implantation, ano po ba yun? Proliferation of endometrial tissue. There might be, ano po ba yung nagkukos ng pananakit, yung pong sobrang pananakit po, no? And other associated symptoms. Meron po bang tulong yung mga ultrasound, transvaginal ultrasound, tsaka MRI? Ano po ba yung tinatawag nilang laparoscopic visualization and histological confirmation? Pag-uusapan po natin lahat yan. And really getting a better sense on the clinical evaluation and differential diagnosis po kung ano po yung mga pelvic pain, no? In addition, we'll be exploring po ano po ba yung efficacy, safety profiles ng mga hormonal therapies as well as other therapies po, no? But beyond that, we'll also be discussing ano po ba yung something that's often overlooked but a crucial factor in the management of endometriosis, and you will have noticed it in the title of our webinar, yung pong role ng diet. So, meron pong mga lumalabas na mga research suggesting that dietary modifications it can significantly influence the inflammatory processes associated with the condition. Yung katulad po ng mga diet that's rich in fruits, vegetables, maybe omega-3 fatty acids, helping to reduce inflammation and alleviate symptoms naman po. And ano po ba yung mga pagkain naman na on the other side of the spectrum na pwede pong makapagpalala ng kanilang mga sintomas na nararamdaman? This is the Health Updates program and I'm your host, Dr. Raymond Francis Sarmiento. Always a pleasure to be with all of you during our regular Friday. Also my pleasure and honor to host this program with one of our program stalwarts po, no? Dr. Stella Marie Jose. Ma'am Stella.
Good afternoon, everyone. Welcome to our participants here in the live broadcast of the Zoom webinar and to all those watching via live streaming on TVUP YouTube channel, as well as the UP System Facebook page, the TVUP Facebook page, and TVUP Signal TV channel 101. Our panelists for today is Dr. Micaela Erlinda Buku and Dr. Hilda Martinez. Our new is now called Health Updates. We used to be called Stop COVID deaths during the pandemic. But we have done a little bit of reformatting for our program, but we are still maintaining the same high quality and then leveling up to take a closer look at the existing and emerging health problems in the Philippines and in the rest of the world. So for 2025, our program is now shorter. We only have 1 hour for our webinar, but stay on and relax and listen to all our very, very prominent speakers. Back to you, Raymond.
Okay, thank you, Ma'am Stella. For our webinar for this week, we want to be able to dive into the heart of the discussion, understanding po how we can support those individuals affected by endometriosis, how we can improve their outcomes and overall well-being. But before that, we'll be watching this very, very short video, which we call the person on the street video, just to gain a pulse on the common folks on the street. Ano po ba yung kanilang kaalaman patungkol po sa topic at hand? And the questions that we pose to them are as follows. Number 1, ano po sa palagay ninyo ang endometriosis? Narinig nyo na po ba ito? Ano ang maaaring ninyong gawin para hindi masyadong sumakit ang inyong puson tuwing mayroon po kayong buwan ng dalaw? At sa tingin po ba ninyo ay makakatulong ang diet para mabawasan ang mga sintomas ng endometriosis? Paano po kaya ito? At sa palagay po ba ninyo, kailan dapat pupunta sa doktor upang magpakonsulta tungkol sa dysmenorrhea? Please watch this.
I was actually diagnosed with endometriosis last November.
Based on what I know, it's just your kind of like the tissue of your uterus is like growing everywhere.
If I'm not mistaken po, sa puson daw po.
They say that endometriosis is kind of like almost equivalent to like period pains, which is actually normal.
It started with basically having dysmenorrhea every single month or every time I'd have my period, and it would be so horrible.
Itaas daw po yung paa pag may masakit yung, or may dysmenorrhea or masakit yung puson. Then, at the same time, lalagyan ng hot compress para po maibsan man lang yung sakit.
Like I could take like 2 tablets of Buscopan Venus and I'd be okay.
What I usually do, I'd either put like a hot compress or I'm gonna do a bit of yoga and stretching just to make sure the abdominal muscles are like not tense. Or, you know, I'll just take pain meds for it.
The foolproof remedy would be to take like Buscopan Venus, like the usual meds. I guess taking it like right before the pain hits. So like when I feel like even a little amount of pain, I take it na so that like for the rest of the day, it'll just subside.
Kadalasan po kasing pinapakain sa akin is yung saging na saba. Most of the time, pag masakit talaga tiyan, most likely, iiwas mo na dun sa mga carbonated drinks and also kape actually bawal din.
Nothing. I don't know that. I don't know that diet could affect it. Well, because women have been taught since we were young that period pains are period pains. If you get knocked out, you get knocked out. So you kind of just deal with it.
Endometriosis is more like an inflammatory thing. I think like adjusting your diet to be a bit more anti-inflammatory in a way can probably help. So trying to avoid, you know, processed foods that are high in fat, or like red meats could possibly help.
To be honest, I'm not familiar with it, but my OB did say that most of the reasons why people get endometriosis is because of bad diet or because of the culture and the diet that we have in the Philippines. So if there was any information for me to know how to curb that, then that would be great.
Kung regular po kayong nasasaktan ng puson, maigi na po magpakonsulta kaysa po baliwalain kasi hindi na po siya normal.
To ask your doctor about it because it's a very valid reason and it's often very overlooked, which tends to make women underdiagnosed with endometriosis or even more serious gynecological conditions. So I think even if you feel just a little bit of period pain, it's better to be safe than sorry and already ask a health professional about it so you can get the help that you need.
Right. She's very correct. Thank you so much, TVUP, for the webinar team po, no? For the hard work week in and week out, just developing these very, very short videos. Thank you for letting us know about what the people on the ground are thinking. Just a little bit of housekeeping before we dive into the webinar itself. Certificates of attendance will be given to those who have watched at least 50% of the webinar duration. So far, we have received only 1 email coming in from, I think, one of the attendees from the last 2 webinars po, no? But aside from that, we assume that all of you who should have received certificates of attendance have already received those po, no? So for our webinar today, we'll have a standard panel discussion format, and after our speakers have presented, that will be followed by a Q&A session. We'll get our webinar underway. Dr. Estela Jose will introduce our main speaker for today.
Our main speaker for today is Dr. Micaela Erlinda Buku. She's a clinical associate professor of the Division of Reproductive Endocrinology and Infertility, Department of Obstetrics and Gynecology at the UP-PGH. Welcome to our webinar, Micah. You can start now.
Thank you, Ma'am Stella, for the kind introduction. Good afternoon, Doc Raymond, Doc Stella. Thank you to TV UP for the invitation to speak on something I'm very passionate about. So this afternoon, we'll be talking about endometriosis. And as Doc Raymond mentioned, it is a debilitating disease associated with chronic pelvic pain. So maybe we'll start off with that. What is endometriosis? Sorry, what happens? Let me.
Can we have help from the tech team? What's happening with the PowerPoint?
Okay, ma'am, I got it. Let me share my screen again. Sorry about that. Okay. So again, before we start talking about nutrition and diet, let's first talk about endometriosis. So endometriosis is a lifelong inflammatory estrogen-dependent disease characterized by the presence of endometrial tissues outside of the uterine cavity. So its overall prevalence in the reproductive age is estimated at 10%. So it affects 1 out of 10 women. And about 30 to 50% of these women with endometriosis would have chronic pelvic pain, which is pain described in the area below the belly button and between the hips that lasts 6 months or longer. Aside from chronic pelvic pain, these women may also present with infertility or the inability to conceive. Now, endometriosis is associated with an increased risk of certain cancer types, particularly ovarian cancer types, cardiovascular disease, autoimmune, and allergic disorders. Endometriosis, as mentioned by Dr. Raymond, can have various presentations, and the disease can present in 3 different lesions seen here. So this is superficial endometriosis, superficial peritoneal disease, where the lesions attach themselves to the lining of the abdominal cavity. I think most of us will be familiar with endometriomas or endometriotic cysts. So these are lesions in the ovary, and they form cysts that contain old blood, or that's why they're called chocolate cysts. And lastly, which is the more aggressive type, is the deep infiltrating endometriosis. These are lesions of endometriosis that penetrate about more than 5 millimeters into the lining of the abdominal cavity. Now, 60% of women with pelvic pain have endometriosis. So I'm glad to hear from our students, UP students, that they are familiar with endometriosis. But what bothers me is that most of Filipinas think that it is a rite of passage, that painful menses is normal, when in fact it is not normal. It's not normal to have painful menses because, as I said, 60 to about actually 70% of women with pelvic pain have endometriosis. Now, this chronic painful nature of the disease impacts various aspects of a woman's life. This includes not just the physical aspect, social aspects, and sexual relationships are also affected. So this leads to an overall decrease in quality of life of women with endometriosis. It causes debilitating pelvic pain, severe dysmenorrhea, painful sex, painful bowel movements, painful urination, and difficulty in conceiving. So endometriosis has also been found to affect pregnancy outcomes, leading to miscarriages, ectopic pregnancies, and neonates with low birth weight. Now, current understanding of the exact cause of endometriosis is still lacking, although the most accepted is the Sampson's theory or retrograde menstruation, where menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity instead of just going out of the body via the cervix and the vagina. So these endometrial cells stick to the pelvic walls and surfaces of pelvic organs, where they grow and continue to thicken and bleed over the course of each menstrual cycle. So current literature indicates that genetic, environmental, and immunologic and inflammatory factors all play roles in the pathogenesis of endometriosis. increased exposure to estrogens is said to be the common link among its known risk factors. Now, the relationship between diet and endometriosis risk is not well characterized, but diet is now being studied to find out what its role is in the etiology of endometriosis. And it is believed through current literature that its role is through influences on steroid hormones, inflammation, and food contaminants. So the role of diet is well established by vast numbers of research in leading causes of mortality and morbidity, such as cardiovascular disease, diabetes, and obesity. Now, these diseases have chronic inflammation as central to their etiology. So given that endometriosis is inflammatory in nature, could patients with this disease also benefit as well from diet modifications? So in an attempt to link nutrition or diet to endometriosis, these two questions come into mind. So first, how does nutrition affect the risk of developing endometriosis? Is there a possible role for prevention? Another question is, how can nutrition affect diagnosed patients with endometriosis in terms of progression and recurrence of pain? Can it serve as therapeutic intervention or perhaps an adjunct to therapy? Now, nutrition is the process of providing or obtaining food necessary for health and growth. When we talk about nutrition, the main focus is usually on diet. So the definition of diet is the sum of food consumed by a person. When we talk about dietary patterns, these are quantity, variety, or combination of different foods and beverages in a diet and the frequency by which they are habitually consumed. So we'll go back to these concepts as we go through the next slides. Now, going back to endometriosis, we mentioned an interplay of genetic, epigenetic, and local environmental factors. These are said to contribute in the growth and maturation of endometriotic lesions. Now, the local environment is affected by hormones, estrogen in particular, as well as the inflammatory environment and oxidative stress. Now, having mentioned that, these are the different points where diet can intervene to prevent progression of the disease. So it can intervene in these points. And we'll discuss that in the next slide. When we talk about diet, we should be aware that food is not just to satisfy the palate, but it is a valuable source of nutrients and energy, which supplies all the raw materials of the various organ and cellular systems, including hormones, receptors, and signaling pathways. Once food enters our digestive system, it is broken down into different nutrients, and it can positively affect our wellness, or it could go the other way. It can negatively impact it by promoting different disease states as influenced by oxidative stress, chronic inflammation, and estrogen dominance. Many of the food items that we are familiar with can increase these mechanisms, which foster the growth and development of endometriosis. Now, modern diet, the Western diet most especially, has been shown to affect disease in various ways. This diagram shows how certain food items on the left can trigger a chronic form of inflammation in the gut, thereby affecting our microbiome and result in gut dysbiosis. This means there's a predominance of more gram-negative bacteria in the gut with limited diversity. And this has been linked to systemic inflammation and other forms of inflammatory diseases, including endometriosis. So the literature shows main triggers of chronic inflammation in terms of food, and these are first, increased consumption of refined carbohydrates, which leads to an increase in insulin levels. So these refined carbohydrates includes rice, white bread, pasta, pizza, potatoes. Second, there is an increased consumption of refined vegetable oils rich in omega-6, linoleic acid, or the precursor of arachidonic acid. So these vegetable oils are rich in omega-6, are precursors of a number of potent pro-inflammatory mediators, including the well-described prostaglandins and leukotrienes. And these are found in these plant oils: corn, soy, canola, sunflower, and safflower oils. And lastly, inflammation has been linked to a decreased consumption of long-chain omega-3 fatty acids, or the healthy non-inflammatory fatty acids. So we are basically what we eat. If we consume inflammatory food, then we create a pro-inflammatory environment or a pro-inflammatory microenvironment. And if we consume anti-inflammatory, natural, unprocessed food, which is what our body is originally designed to receive, then we can promote wellness and prevent disease. All these factors can promote the development of endometriosis through the mechanisms of inflammation, oxidative stress, estrogen dominance, and gut dysbiosis. So let's now discuss how diet can increase the risk for developing endometriosis. So we already mentioned that the beauty with diet is it is a modifiable risk factor. And it is such because of its influence on hormonal levels, the immune system, and inflammatory activity. Diets promoting systemic inflammation and oxidative stress, seen here in red, particularly red meat, and saturated fats such as butter and trans fats, can enhance endometriosis risk and its progression. Whereas food and nutrients that have anti-inflammatory and antioxidant properties, seen here in green, may help decrease the risk and disease progression. So what do the studies show? There has been there is a 40% increased risk in endometriosis with the consumption of trans fat. So that has been reported in studies, particularly in Europe and the Americas. So trans fats are plant oils that have been chemically changed to be solid fat. So it is processed, basically. And actually, this because of trans fats' ability to have a long shelf life, a lot of processed food employ this in order to keep it longer, keep it from decaying longer, so it has a longer shelf life. So fast food and processed food have high trans fats. So increase in trans fat and saturated fat increases the production of steroid hormones, thereby increasing the occurrence of estrogen diseases like endometriosis. They increase inflammation by increasing metabolic molecules that participate in inflammatory processes. So on the left here, you can see a summary of the studies that looked into the effect of consumption of saturated fats on the occurrence of endometriosis. And you can see here that most report a significant increase, as shown by the arrows, significant increase risk or increased association with endometriosis, particularly the study by Mismer and colleagues in 2010. Red meat is a rich source of cholesterol and to some extent saturated fat as well, and it has been shown to increase the risk of endometriosis because of its pro-inflammatory substances, which serve as substrates for prostaglandin synthesis. But not all fats are evil. So here, studies have also shown that there is a decreased risk in endometriosis when there is a high intake of omega-3 fatty acids. So omega-3 is found in fatty fish, seaweed, and nuts. And omega-3 fatty acids decrease inflammation, and studies have already shown a regression in endometriotic lesions. So these are the studies that show significant association of a decreased risk of endometriosis and high intake of omega-3 fatty acids. What about fruits and vegetables, as mentioned a while ago? Studies in fruits and vegetables show a decrease in risk for endometriosis. Now, researchers hypothesize that this decreased risk is brought about by the reduction in DNA methylation. So this is epigenetic effects. So fruits containing high levels of antioxidants, thereby reduce oxidative stress, and decrease inflammation. However, there are some studies that show conflicting results. And this may be attributed, conflicting results meaning that some fruits and vegetables are associated with an increased risk of endometriosis. But this can be attributed to the presence of pesticides. So we noted that studies who report that there is a decreased risk of endometriosis with high intake of fruits and vegetables were done in mostly European countries versus this one study that was done in the Americas. So the discrepancy can be attributed to the presence of pesticides, which act as endocrine disruptors and negate the beneficial effect of vegetables and fruits. So in Europe, they have stricter laws when it comes to pesticides compared to the Americas. So that's where the discrepancy came in. Hence, it's not only advisable to have a high intake of fruits and vegetables, but proper food handling and washing should also be emphasized to decrease pesticide residue during consumption. Now, consumption of more than 3 portions of food enriched with vitamin D was seen to be associated with an 18% decreased risk for developing endometriosis. Patients with high levels of vitamin D have a 24% decreased risk for developing the disease. And since vitamin D3 is cheap and overdose is rare, it is a good supplement to take for patients with endometriosis. Okay, now that we have discussed the association of diet with the development of endometriosis, what is the role of diet in patients who already have endometriosis? Can it prevent progression? Can it cause regression of the lesions? So current studies show that these nutrients were able to decrease the symptoms of endometriosis. So omega-3 fatty acids, so similar to those that affect development of the disease, studies have also shown improvement in symptoms in diets that are rich in omega-3 fatty acids, vitamin B12, resveratrol, which is found in berries. So it's a powerful antioxidant and anti-inflammatory agent, and N-acetylcysteine. So these were all found to decrease symptoms of endometriosis, as well as some of these, particularly, and again, vitamin D3 was already shown to decrease or cause regression of the lesions when they are given in high amounts. All right, so diet affects, just to recap, diet affects the microbiome and hormone metabolism. A healthy diet, as seen here, would result in a healthy and diverse microbiome, thereby creating balance in the microenvironment or the system. So there is a balance of hormones, hormonal balance. Now, when there is intake of pro-inflammatory food, this leads to gut dysbiosis and results into chronic inflammatory diseases, including endometriosis and estrogen predominance, which will foster the progression of the disease. We mentioned dietary pattern at the start of this talk. So dietary patterns, again, are a combination of the different food, the quantity, etc. And dietary patterns are more important, actually, rather than the intake of certain individual food items. And studying dietary patterns aids in the formulation of dietary guidelines, as these display real-world conditions and may be more applicable and adaptable. Now, I mentioned this before, the increase in the intake of the Western diet, which is rich in red meat, processed food, prepackaged food, saturated fats such as butter and fried foods, as well as refined grains and high-caloric beverages, sugar-sweetened beverages, have resulted in chronic inflammatory states and oxidative stress. So basically, this is the diet that we all need to avoid. Now, recent studies on Mediterranean diet show that this is beneficial in reducing cancer rates, cardiovascular risk, obesity, diabetes mellitus, stroke, hypertension, and dyslipidemia. A single-arm study in Austria studied the influence of Mediterranean diet and endometriosis-associated pain. And the authors reported a significant relief of general pain, dysmenorrhea, dyspareunia, and dyschezia. So that's painful sex and painful bowel movement, as well as an improvement in the general condition or general well-being of patients with endometriosis. When we say Mediterranean diet, it is comprised of the following: basically heavy in green leafy vegetables and fruits, whole grains, and healthy fats. So basically whole, minimally processed or unprocessed foods, and it avoids animal products. So attention to food quality and promoting locally sourced organic food whenever possible has also been recommended. Okay. And lastly, plant-based diet or plant-based whole foods diet. When we say plant-based diet, it's basically just vegetables and fruits. When we say whole foods, it does include a few animal sourced meat, but these are organically grown, such as grass-fed meat or properly not farmed fish, etc. So whole, minimally processed foods are also seen here in the plant-based dietary pattern, and focuses on plants including vegetables, fruits, whole grains, that we discussed to be associated with a decreased risk of endometriosis. It excludes refined food and highly processed food. And again, attention to food quality and promotion of organic food is promoted by plant-based whole foods dietary patterns. So to conclude this talk, is there an endometriosis diet? Well, the studies are still insufficient to promote endometriosis diet. However, there is a lot of data pointing to an anti-inflammatory diet, which may show benefit in preventing the development and progression of this disease. So basically a diet that is nutrient dense, natural with high fiber, rich in antioxidants and omega-3 fatty acids, high intake of vitamin D3 and resveratrol, and the avoidance of red meat show promise in the treatment or adjunct to treatment of endometriosis. So before I end my talk, March is actually Endometriosis Awareness Month, and that's why I'm wearing yellow. I like to invite everyone to raise awareness about endometriosis. Let's end the stigma of painful menses. It's not normal. I'd like to invite everyone to our lay forum on endometriosis on March 5. This will be in the nurses' home at the Philippine General Hospital. So for all those, for our viewers who are not yet familiar, we have a Center for Endometriosis, and here we manage the disease. We have a multidisciplinary approach to the management of the disease. So with that, thank you so much for your kind attention.
Thank you very
Okay.
much, Dr. Maika Buku. It was an excellent lecture. Even if I know some of them, pero nagulat pa rin ako sa new data that arose. And later on, we have the question and answer portion, and maybe our audience will also have questions. Raymond.
Thank you, Dr. Buku. We'll call you again during the Q&A. At this point po, we will take the opportunity to greet those who are joining us. We are live broadcast po, but we are being viewed by those who are coming in from the University of Rizal System in Tanay, Rizal, May Kawayan Doctors Hospital and Medical Center in May Kawayan, Bulacan, the University of the Cordilleras in Benguet, Baguio, Mariano Marcos Memorial Hospital and Medical Center in Batac, Ilocos Norte, Olivares General Hospital in Parañaque, Metro Manila, Oriental Mindoro Provincial Hospital in Calapan, Oriental Mindoro, and the Municipal Health Office in Balete, Aklan, as well as in Davao. Also from the province of Bataan, from Marilao, Bulacan, from the Nursing Service Office of the Royal Pontifical and Catholic University of Santo Tomas Hospital, staff From Antipolo City, we mentioned the University of Rizal System Health Services Unit. Thank you so much, the province of Rizal. Those coming in from Los Baños, Laguna, maraming salamat po. Those who are joining us from First Gen Corporation, our avid viewers po, thank you. From Malolos, Bulacan at La Consolacion University, thank you so much. From UP Diliman and Hospital ng Binyan. Internationally, we are also being viewed by our avid viewers po, no, from the Ryan Hall Shanex Incorporated in Bridgewater in Canada, Chonin Hospital in Taipei City in Taiwan, and Nam Canto University Hospital in Canto City, Vietnam. So maraming salamat po sa inyong suporta, and we encourage everyone to put in your questions in today's Q&A session. As well, if you are watching us in YouTube, maybe you can put that in the comment section, or sa ating Facebook pages, UP System TV UP Facebook pages, you can also put that in the comment section. Okay, our reactor po for today, she's a retired faculty, and she was Professor 11 po, no? From the same division, from the Division of Reproductive Endocrinology and Infertility of the Department of Obstetrics and Gynecology of the UP Philippine General Hospital. Please welcome to your screens, Dr. Hilda G. Martinez.
Good afternoon, everyone, and thank you very much for this invite to react to. Again, I also have a passion for the role of diet and nutrition in various women's health issues. So for this, let me just say that from the perspective of somebody who has practiced, as have been said, we were retired. In our past, as in residency, the prevalence of endometriosis was rather low, and we usually got it in women who have practically almost completed their family size or approaching 40s. Today, most of our consults are coming from women even in adolescent, and some who have just started menstruating, even just 3 years from their menarche. So what is happening? And I think this consciousness is what is important, that we already know that we're in a toxic world. There has been an increasing incidence of PCOS, which really causes a lot of hormonal imbalances, particularly hyperestrogenic states. We have a prevalence of obesity, and we also have various changes in lifestyle, which is really way far from how we were truly made. In fact, many universities abroad have already dwelled in putting functional medicine into the medical education with emphasis on nutrition, wherein you already have clinical nutrition. So we have answers to our patients when they ask us what is really a healthy diet. We are all guilty that we can't even answer that. And most of us would just say in moderation. So if we're going to look at even medical students or even our friends and colleagues, how do we really eat? So as has been discussed earlier, what is aggravating or increasing the prevalence of endometriosis is a lot of changes in our lifestyle that is no longer compatible with our evolutionary makeup. So for example, inflammatory foods or industry food, I would call it, has practically increased to as much as 60 to even 70% of what we eat. If you go to the supermarket, everything is processed. It's only in the produce portion wherein you can see whole foods. So it's not very far or very surprising why we have such a high increase in diseases that are inflammatory and would reflect hormonal imbalances. Today, we have also an increase in infertility, which did not exist when we started. The problem then was how not to get pregnant. So if we're going to look at each one, because I'm looking at it in a general point of view, wherein what has already been discussed, that endometriosis, which is a chronic hormonal inflammatory disease, arises from both the hormonal dysfunction or the hyperestrogenic state, an increase in oxidative stress and chronic inflammation, and again, disturbances in our gut microbiota. So going back to the basic food, we did a study at the Philippine General Hospital, which was an initial study, which was just a questionnaire. To emphasize, it's very hard to design studies that would fit and give good information on the role of nutrition, basically because there are many confounding factors. It's no longer the same as when we're doing research in such things as infectious disease or other diseases not of the chronic type, which we have today. So it's very hard to prove the significance of nutrition. But I think it's not very far that even just association studies would already give us the answer. So even looking at the different food that exists today, the most inflammatory are all processed food. And I think we should recognize what processed food is made of. It's basically, there's a lot of not real food, no longer recognized by our body as food, which disturbs our immune system. And that is why we have many inflammatory diseases existing today. Also, the presence of a lot of sugary foods, which creates chronic inflammation. And if we're going to go to the history, before the 1900s, we are consuming 10 times the sugar. And it's like a factory that can only process 1 truck full, and now there's a delivery of 10 truckfuls. So if we're going to look at the general food intake, regardless of even people in the medical profession, because most of my patients are nurses, doctors, medical students, and if those in the medical profession still don't get it, then how can we expect the general population? So we should be able. And my dream is my university should put emphasis on the role of nutrition. We as doctors should understand it up to the molecular level to prevent all diseases related to lifestyle. And endometriosis is just one of them. So until we remove our mindset of just using interventions of medication, surgery, which, by the way, if we operate on endometriotic cysts, will just decrease the ovarian reserve and will do more harm than good, then we will not move forward because we no longer can handle the increasing prevalence of all these chronic diseases. And it should be started early, preconception, in the womb, in infancy, and throughout the life cycles of every individual. So instead of going back to all that has been discussed, I would rather go to a question and answer. But to me, I would like every doctor to be proficient in using nutrition as a tool in order to stress more on the preventive aspect of all these diseases. And this goes on and on, actually. And I want every doctor to be an example of good health as a result of practicing what you walk your talk. So I think having better understanding on this tool, the important tool of diet and nutrition, not just in endometriosis, but in the various diseases, then we would say that we are successful in health, in promoting health for every woman. So thank you, and I'll just answer the questions from the floor. Thank you.
Thank you so much, Dr. Martinez. Ma'am Stella?
Thank you very much. Thank you very much, Dr. Hilda Martinez. By the way, Dr. Martinez is the mom of Dr. Maika Buku. So they are a mother and daughter pair. So I have a question for Maika. In your presentation in the Mediterranean diet, you emphasize that they can eat chicken kasi that's also one of the food that I tell my patients not to eat chicken because of the high fat content of the chicken skin. What is your opinion on that?
For the Mediterranean diet, there, if you search for the Mediterranean diet, there's actually a food pyramid that denotes the Mediterranean diet, and the base of the pyramid is mostly whole grains and green leafy vegetables. So the poultry that was included in that table is very, it's taken, if they are to take poultry, then it's in very minimal amounts. And we usually recommend responsibly sourced animal meat products. So please refrain from getting your chicken, for example, in the supermarket, because they give a lot of growth hormones. It's already incorporated in the feeds. If you compare it to, say, free range native chicken. So I do agree, Doc Stella, that they should remove the skin of the chicken, since it is high in cholesterol. And before, we used to tell our patients to avoid the chicken wings, because that's where they usually inject the hormones or whatnot that they use to increase the growth of these farmed chicken. Now it's no longer just the wing, it's now found in the feeds themselves. So I spoke just sharing what I recently got from a friend who has like a poultry farm. So these companies give them the chicks and also the feed. So from 40 to 50 days, 40 to 45 days of growing the chicken from a chick to a mature chicken, now it only takes 25 to 30 days. So isn't that alarming? What are they putting in those feeds? So, but that's a completely different topic. That is endocrine disrupting chemicals. So that would be very interesting also to discuss, because it's all interrelated. Mm.
Yeah, thank you for your answer. I have a question for Dr. Hilda, for Gigi. No? My question naman is, I noticed that that endometriosis really is linked to cancer of the uterus or cancer of the ovary. So, in your practice, how often do you find this situation? Kasi parang dumadami na yung ganun, yung
Yeah,
nagkakaroon ng cancer from
it has been
endometriosis.
increasing.
Yesterday, I attended the Manila Doctors Hospital case conference. I was a speaker there, and yun yung case nila doon, cancer arising from endometriosis. What is your comment on that?
It's not very surprising, because you have to look at the entire environment wherein, it's actually linked to metabolic health. And metabolic health has already changed even in the very young. In fact, I am already looking at the lipid profile of even 12-year-olds. And most of them have some form of insulin resistance, when it should be normal that you have an physiologic insulin resistance at that growth state, but it's extreme. So if you look at the environment, the general environment wherein you have chronic inflammation, then it's not very far that you can develop, because it's really combination of the inflammatory state and the excessive oxidative stress. Like when you put in a lot of, the problem now is overconsumption actually. And it's not necessarily in an obese. We've been seeing a lot of lean patients who, when you look at their laboratories, are metabolically obese. They have high cholesterol. They are insulin resistant. So with this chronic state, then it's not very far that we would have changes that can turn into cancer. So even in most cancer centers abroad, they have already integrated several lifestyle interventions or integrative medicine. So like, for example, putting them on a keto diet would lessen, because since cancer cell can use up fats. So I think going back again, then it's again understanding what are, because for example, fats has been demonized, but we should be able to differentiate the good fats. So like mentioned earlier, the polyunsaturated, that the proportion of your omega-3 and omega-6. So these are important, because if we know that these fats are the ones that will form the cell membranes of our cells, then we know that the defects will be already in the receptor level. So we're seeing even changes in the responses to medication. For example, suppressing with GnRH before was very effective. Now, even giving already the full dose of your GnRH agonist, and it's not yet suppressed. Why? Because the receptors themselves are changing. So the presentation, the behavior of the diseases, even endometriosis, is already changing. So it's very easy to have malignant change.
Thank you for your answer. Raymond, do you have a question?
This question already
From
answered
the
by
audience.
Dr. Maika, but I'd like to highlight it just because I think there are follow-up questions po, no, or similar questions around it. So the question is, which is better to reduce the endometriosis? Is it you take veggie meats or you take animal products? So we would like to hear directly from Dr. Maika about that.
Yes, actually, veggie meats are highly processed. So if you look at the back, they contain a lot of trans fats. So don't be fooled by all veggie. I'm not saying all, but most of the veggie meats are processed food. So they still contain trans fats. I would rather that if you will be taking, the question was veggie meat or animal product. Maybe it would be healthier to actually opt for the animal product, which is responsibly sourced, whole food, unprocessed, rather than something that's processed. It will always be the healthier choice.
Okay. Ma'am Stella, on your end.
I would like to inform our audience that this webinar is being recorded and it will be played for 1 week next week, and it will be shown in Luzon, Visayas, and Mindanao. So for those of you who were not able to catch up on the webinar, you can go to our YouTube channels. That's all. Raymond?
Thank you. I think the last question will come in from Dr. Joseph Torton. Again, well, I think percentage likelihood of those who develop endometriosis if your family is really vegan daw po.
Oh, okay. So the exact prevalence of endometriosis in vegans have not yet been established. But again, going back, it's kind of related to the question about the veggie meat versus the animal meat. Again, the vegan diet does not prevent exposure to other things, particularly trans fats and saturated fats and plant oils that are high in omega-6. So it just because you're eating a vegan diet doesn't mitigate the exposure to these harmful food products as well. So it's maybe that's why there's no established data, because it's tricky to do the study unless you really go through and make sure that this vegan is taking whole foods versus a vegan that's taking processed veggie meat. So yeah, that'll be interesting.
Okay, I think we don't have any more questions, but
I think
Dr.
Dr.
Ina has a
Martinez,
comment.
yes.
No, I just want to point out that a simple guide is, let's do mindful eating or mindful eating. I mean, before you put in anything, you can be vegan, but I can eat chocolate chips, cookies, I can eat there's so many
French
things
fries.
inflammatory, French fries, etc.
Yeah.
So when you look at the food before you eat, then intuitively you can ask, will this do good to my body or not? Because the problem now is the damages is epigenetically passed on. So there's a real multiplier effect. And if you can see it, the previous generation was better than mine, but the next generation is worse than mine, and their next is worse. So if you look at the different diseases and their different responses, it's also going to be very different.
Okay, thank you. Thank you for that, Dr. Hilda. With that, we don't have any more questions lang po. No? We'll do, at this point, we'll do our evaluation poll. It's 5 statements po. No? It's a 4-point Likert scale. We're flashing them on the screen, and we encourage everyone here, especially in the Zoom, to be able to answer all of these. So I'll read through it, and we will not be closing this until the end of the webinar. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. Okay, again, we encourage everyone to go into this evaluation poll, put in your feedback, and if you have any more comments, just put them in the comment section or here in the Zoom comment section as well, Facebook and YouTube as well. In the meantime, as mentioned by Dr. Stella, you will be able to still watch us on the playback at the TVUP YouTube channel and the TVUP Signal TV channel 101. For next week, we will start celebrating Women's Month. Ma'am Stella, what is our topic for next week?
For next week, wait, I forgot to check. I'll announce it later. Go on first.
Sige, ma'am. No, we'll have Dr. Lorena Santos, who's an infectious disease specialist from what I understand. So
Yes.
we'll
Okay.
have
Yes.
the
Lori
gynecological
Santos.
IDS. Yes, ma'am. Before we conclude our program, all health updates webinars are archived for viewing at the TVUP YouTube channel. So you just go to www.youtube.com/TVUPPH and you'll be able to see on the live tab all 227 episodes that we have so far. After today, it will be 228 episodes na meron na po doon. On the other tab naman po, which is the shorts tab, the same channel, you can see our health update short videos po that are selected presentations we feature in snippets found in YouTube Shorts. So we encourage everyone, maybe you're waiting for your cup of coffee, maybe you're waiting for your Grab or waiting for the train to arrive. I hope you'll be able to take the time out. You'll be able to gain nuggets of wisdom from those very, very short videos po natin. So this formally closes our webinar for the week. Makita-kita po tayo ulit next Friday from 12 noon to 1 p.m. It's a date.
Together, we can stop preventable death.
So keep safe, keep healthy. See you online.